point, 0 point, we start from the first point where that is the isolation. The isolation can be performed using different mouth clamps, liquid dams, and rubber dams in order to obtain this goal. That means avoid gum burns, as you can see in the 3 images that you can find over there. So mouth clamp, different mouth clamps, as you are going to see over there in the following slides, and rubber dam in some situation. I always use rubber dam in my adhesive treatments and also in cases where I need to perform an endodontic dental bleaching procedure, as you can see in the specific session about internal bleaching. So we have in the marketplace different types of mouth clamps. For example, in the movie that is going on the left, you can see a very common mouth clamps that is performed by and packaged by Care, and it is a very useful mouth clamp because as you can see in the movie, it's very useful and very stable. While in the right movie that has started just a few seconds ago, you can see a softer mouth clamp that is for sure a very useful mouth clamp that is very common and very used in every procedure, both for orthodontic procedures while cementing brackets, or for example during restorative procedure, both direct and indirect. And we can associate for these 2 mouth clamps this nice tool that is called lip bumper, that is a plastic bumper that the patient is able to bite in the posterior areas, in the premolar or molar, and is able to separate the 2 arches in order to isolate them each other and in order to obtain a good separation, avoiding also the accidental remotion of the mouth clamp. It's very important to understand that these mouth clamps are created in order to be used only for one patient, and we are not able to sterilize it in a classical way because it is completely destroyed over there. An interesting area is that one, the middle area, that is created in a vertical shape in order to separate the tongue from the teeth, and also in order to avoid the saliva to go towards the dental bleaching that is in the buccal surface of the teeth, and so in order not to dilute the dental bleaching, while the 2 areas, the 2 twins area that we can see over there are 2 different horizontal areas with this hole in order to link the floss and to avoid accidental ingestion, and they are the areas where the patient, where we ask the patient to bite this lip bumper in order to separate the arch. It's important as a tool to choose properly the size of our mouth clamp, because we can have different size of any mouth clamp. As you can see on the left, we can have the smaller one for the Care mouth clamp, or the larger one, and these plastic rigid they can be used with a normal traditional sterilization, so you can use for a lot of time before discarding them, and they are built with these 2 separate wings in order to separate the cheeks, and these 2 areas in order to separate the lips, both the upper and the lower, and we have these 2 plastic areas both for the upper arch and lower arch, where that you have to position in order to maintain the frenulus in the frenulum in the middle. And this is the only negative effect of these 2 mouth clamps, because they are very rigid, for sure very stable, but sometimes some patients refer to have pain due to these 2 areas created in plastic, in rubbers. While in the right image you can see that you have the Optragate by Vivadent. You can have in 2 different sizes, one, the larger one, that is called regular, while the other one is called S, and it is smaller. And you have also another version that is the junior version for kids. I normally use the regular one, but obviously you need to understand and to decide what fits better in the mouth of your patient. Because for example, positioning the smaller one in a larger mouth, it means a possible accidental remotion of the mouth clamp, especially for the soft ivoclar version, that could mean an accidental touching about the teeth on the dental bleaching gel, as you can see in the lesson about complications and accident that could really happen over there. So I suggest that for one patient, once you have suggested and you have selected and tried the best size that really fits for this patient, to note it on the chart of the patient, and for the second appointment you still have the size of your mouth clamp. There are also some other mouth clamps in the marketplace, like this one. This is another rigid mouth clamp in plastic. It could be used also for many times after sterilization, and it is composed and built in order to separate the cheeks with the two lateral wings. Then you have an horizontal bar over there. This is the size, is the M, so the medium. So you have also here two different sizes. And the middle area, the horizontal area in plastic, has the same function of the lip bumper. So the patient is asked to bite that area in order to maintain the two arches separate each other. And it is very useful because in this way you have a stable mouth clamp without the pain in the buccal area of especially in the upper arch. And you can also add another interesting tool about the suction, that is this one, that is with this according to its perfect shape. You can use it and you ask the patient to incline a little bit the head from the same side of the suction system in order to obtain a good treatment without the problem of saliva that can touch the teeth, dilutes the gel, and generates gingival burns, as you can see in the side effects lessons. So in other cases, especially when I need to perform an endodontic bleaching treatment in the same moment of vital bleaching, so for example a bleaching of the same arch where one tooth or a group of teeth needs to be bleached also internally, I perform my isolation using rubber dam. And obviously you can also combine liquid dam plus the rubber dam in order to cover the open area, and you need to link with the floss to do the ligature in order to create a good isolation. As you can see in this image, that is correct. Here in this specific clinical case, I was performing an internal bleaching of the two central lower incisor, and obviously you need to isolate properly all the clinical crown of the tooth, because otherwise the material, the gel, the bleaching gel will not bleach all the surface of the teeth. The same image with a good aspect of isolation as well, also for the upper arch, was in this other clinical case, while here you can see a wrong isolation using a rubber dam where the material was not applied correctly because as you can see over there, you find that the rubber dam is not placed correctly. So in order to obtain a good isolation, obviously you need to have a good instruments, a good equipment. The first equipment that is really useful is represented by the sheet of the in latex, as you can see over there, and then a good template. I like to use a lot the template that is called the PACDA, that was invented by the friends Gaetano Paolone, and you can follow his lecture and the lecture of the other friend Salvatore Scolavin about We Restore channel, where you can find all the things, all the tips and tricks about isolation. Here, just to give you some suggestions in the same way they work, we use the pack them as our precise template in order to decide to isolate, for example, 10 teeth from the second upper premolar to the second upper premolar in the opposite, in the adjacent arch, hemi-arch. And here, in order to obtain, as you can see and follow by the movie, in order to obtain a good isolation, we always need to isolate it properly, starting from the holes, and so starting from the punch that we are going to create. I normally use the bigger one, or also the not the biggest, but the second one immediately after the bigger. And I use the same size for punches for all the arches that I need to isolate. After that, as you can see in the movie, we need to be very precise, so the hole needs to be perfectly shaped in order to avoid the rubber dam sheet to be destroyed. And now, after having created the punch, we are starting to isolate the aesthetic field from the second premolar to the other second premolar, and we apply the other clamp. So first of all, I need to start to check the clamp and the stability of the clamp. So once the clamp is stable, we can decide to use in two different methods: the parachute technique, or the technique where we place before the sheet of the rubber dam and then the clamps in order to isolate, and then with the help of our dental assistant, we are now isolating all the field and placing the arch in order to have a stable area situation. Well, in this situation now we are ready to pass through the floss, the rubber dam in the middle of the area. I recommend not to use a strong, not to be so strong, but to floss easily and to floss in a proper way in order to go around the mesial and distal surface of any tooth. And according to this slight movement and slow movement, we are able to perform our isolation. Then, according to the use also of a spatula for restorative treatment, we try to invaginate all our rubber dam in order to obtain a good isolation, thanks to the use also of the ligature using the floss. It's a double link, so we apply the first ligature as in the movie, and with the use and with the help of the assistant maintaining the spatula in the palatal area, we are able to put the floss under the rubber dam, and then we are able to close the link and to block the area, as you can see in the right movie as well, and applying with the spatula and isolating it in a proper way. I recommend to isolate a larger number of teeth than more than the teeth that you are going to treat, in order to have an aesthetic field that is really clean and safe. And here you can see the clamps that I am going to use to block and to be stable in the two premolars. In case you want to have an open field in the anterior area, you can use these nice tools. It's an anterior double clamp that it was cutted before with a metal disc, but as you can see, it's completely unstable, and also it's an obstacle for the hands. So you can use a flowable material. In this case, I use the BW, that is a fluid that I normally don't use. Every one of us has a flowable material that we have both some months ago, and we have a lot of this syringe over there. So you can apply there without etching and adhesive in order to have a stable clamp, and we have an open field without being a problem for our turbine or micromotor in case we need it. For all the areas that are open, so when we have a gingival that is still visible, you can use your spatula to adapt some Teflon stripes and to combine the use of rubber dam plus Teflon in order to obtain a safe area. Second point is the technique, how to use. For sure, you need to know to use high percentage hydrogen peroxide. I recommend to go and to jump also to the section about materials, products, and all the laws in Europe and out of Europe in order to understand which material fits better for any technique. We can work with these materials for vital and non-vital treatments, and there is also a specific session for non-vital treatments, and you can combine a lamp laser assisted that is called power bleaching, as you can see at the end of this lesson, in order to obtain a good aesthetic for any case. But remember, according to product lesson, that the treatment that really work better is represented by the home bleaching, because in-office bleaching has the lowest duration and we have a lot of limitation and also a lot of cost for our dental office. So I limit this procedure only to non-vital situation where I don't have any other chance, and I limit this situation only to the clinical cases where the patient want only an in-office treatment, in case with lamps or laser, but I try not to use them anymore, as you can see at the end of this lesson. So finally, we try to reach our best and to obtain a good aesthetic result, and comparing pictures as per the marketing lesson before and after, and showing also to the patient for any case like this or like these other cases with a good aesthetic results, or like these other strange cases. The patient here was 90 years old. It was a patient, an old historical patient of the office, and she has a commercial activity in my city. And even though the age is really high, the aesthetics was, the aesthetic request was high, because the patient wanted to improve her aesthetics. So I checked the color and matched the color, as you can see in the other lessons. And then here I decided to use an in-office bleaching that was packaged in drops. So 3 drops from the base, 1 from the catalyzer. And the particular advantage of this material is represented by the color, because once you apply the material on the teeth, it seems that the color is like violet or purple, and after some minutes it becomes green. That means that the dental bleaching procedure is going on. Not that it is finished, but it is still and properly working. So some dental bleaching materials has also this chromatic help for the clinician. Right now we passed from an A4 Vita shade to an A2 Vita shade, and this is the final view, intraoral view. Let's have a look to the reference literature reference below, written by Iwood like several years ago, 2007, in Aesthetic Dentistry Today. Iwood wrote an interesting article about bleaching and caries control in elderly patients, because we know that any patient has this important tool as a request that can do with his own or her own clinician, because in any age you can perform a dental bleaching procedure. So, going to the technique, liquid dam, which one? Before talking about the quantity and how to apply it and how to apply the liquid dam, we need to understand the differences between the liquid dams. For sure, I don't use white liquid dams because they have the same color more or less of the teeth, so it's better to have a complete different color in order to isolate properly. Then we can have a different color, shocking or not shocking color, and this one with these star-pointed particles are strange materials that were born some years ago during the boom of and the development by companies of the power bleaching, because it was like some small stars able to reflect the light of the lamps and laser. We know perfectly that they are useless. We don't find any benefit about the using of this rubber dam. So I recommend only to use colored blue or violet or green liquid dam. Right now, how much liquid dam? For sure, here we have too much rubber dam, as you can see in the red circle. In the green circle, everything is green because the quantity is correct, while in this other case, as you can see, there are some recession about the patient, referred also by the patient by a wrong habit in toothbrushing. And here, a correct diagnostic process is crucial, and this is very important in order to communicate with the patient that this area, the area of the recession, will not be bleached for two reasons. The first one is hypersensitivity, in particular of patients like this, the young age. The second one is that the dentist is not able to be bleached, or better, can be bleached but not very easily and not in the same way of the human enamel. That means that we can avoid for sure the bleaching of these two areas for these two meanings. And in the past it was very common, especially during the development of power bleaching procedures, to use a lot of liquid dam, like in these two old images, because in the instruction of the lamps and in general of the power bleaching procedures, it was written down that everything pink should be covered or should have been covered by liquid dam. That means a lot of time and a lot of money also for covering over there. So I didn't like this one also 15 years ago. So liquid dam, how much time is another question, because time is money, you know, and we need to balance the application of liquid dam in order to isolate properly without spending so much time or so much money. So this is the way, like in this diagram, in how I work. I normally start in the upper right arch from the central incisor or the lateral incisor, applying a small quantity of liquid dam and covering all the zenith, the gingival zenith. It's better to be precise, as you can see later, using your magnification tool and decide how many teeth needs to be covered according to the aesthetic analysis, how many teeth are visible. So the smile line is important, but it's also important the width of the smile. Once the half upper arch is finished, I didn't cure over there, but I started to isolate the opposite hemi-arch in the same way. Don't be scared by the fact that everything can be removed easily, or the material can flow slowly, and you can see the teeth covered by the dam, because this material has a good consistent and the good consistency we are able to cover and to wait also for some minutes. And then right now we are ready, and we ask our dental assistant to cure both arch. And for sure I will finish some parts that are uncovered in a second moment. Now I am still in the lower arch, and I am ready to start for the third part, the third point, is this area. So I perform this one starting from the start, and then I perform the second part in this way, and then from the distal to the mesial in the same way, in order to isolate also the other half part of the lower arch. in the same way. And now, as we did before, we are ready to perform the second part of the upper arch in the same way, from the distal to the mesial, according to the teeth that I want to cover and to protect before doing dental bleaching. Here you can use also a probe. If you have a recession, like in that case, you cover more, you accurately cover the papilla, and then you pass to the gingival zenith. It is very important to do accurate, slow movements using your flowable material as a brush, without spreading too much, and then closing the papilla area in a second moment over there in order to fill it, and then now we can cure. As you can see by the drawing over there, totally 3 minutes and 30 seconds for one mouth completely. So liquid dam, how much precise is another question. If you use your magnification, for sure you don't do and you don't have this aspect where you have a incorrect position or areas that are uncovered. So I recommend to use your loops or your helmet system with magnification in order to be precise. And regarding this, the quantity nowadays is this one, even though in this old image the quantity of gel, we will speak in a few minutes about it, is too much. And so once the material has finished, and we speak about the time in the specific lesson about materials, you activate your suction system. Here you can see that in this area some material touches the gum, is not a problem at all, and you can finally manage it in a few minutes, and we will come back to the beginning and we will be safe. Let's have a look to this clinical case. It's very important, as you can see in the diagnostic process, to have an X-ray evaluation before starting your treatments. There are some teeth that can be bleached and some teeth that can be bleached with attention, and some teeth that can be bleached or better are unbleachable because there are crowns on implants, so it's better to avoid the contact of the material over there for two reasons. The first one is that it's completely impossible to bleach the ceramic, and the second one, I won't want to touch with my dental bleaching material the surface of the gum around the implants because they are very delicate. And so this is the aspect of my dental bleaching application. And let's have a look here when I am positioning the rubber dam, and here I have some recession that are quite long, and so in a huge area, a large area of recession, so it's a nonsense to cover completely all the area. So this is enough. And let's have a look on the opposite side where you can find the composites over there. And as you can know by the first lesson about diagnosis, you know that the interface between tooth and composite is not affected at all by the action of hydrogen peroxide or carbamide peroxides. So first, I will not be precise for sure perfectly in the interface between composite and teeth, and second, the interface is not damaged by the oxygen. So I am sure and safe, and I will use my composite like an isolation. So I will isolate over there, just at the end of the clinical crown, but I will be for sure very far from the area of the gum. And the quantity of the gel now is also very important, and is an important question. How much gel? Because in the past it was my image, and now it is my image. Let's have a look at the difference between the liquid dam and the bleaching gel. Less quantity of liquid dam and less quantity of gel instead of the past. It's like this normal procedure for men, where you don't need to shave your beard, to use a lot of material, because the only area that is in contact with the skin is able to create a good shape. So here we have the same. If you apply this normal concept to the dentistry, here we can see that the real area that is able to bleach teeth is represented by the part of bleaching gel that is in contact with the buccal surface. So putting a big area, a big quantity of material is a nonsense and can waste a lot of material and a lot of time. It is the same concept that we can apply in the home bleaching techniques, where the reservoirs are created and are performed using a good thickness, more or less 0.5 thickness of reservoirs on the stone models, because otherwise we need to use so much material and we can have a over-dimensioned, oversized tray, and we'll have only a waste of material and the risk of gingival burns. So the technique is very simple, because once you have isolated your teeth, you apply like a spot over there. I prefer to use classical flowable tips, not the classical materials that are classical tips that are represented and performed with the normal packaging. And then using a probe, my assistant helps me. So I apply the material and she flows perfectly in the clinical crown. And in this way you can keep it simple. And I always recommend to keep it simple, like in this kit drawing, because sometimes there are some alternatives suggested mainly by companies. So for example, hydrogen peroxide 20 or 25%, and in this case with the pre-charged trays. And the problems here are frequent burns, selective therapy is not allowed, frequent correction after, and not cheap, for many reasons. Let's have a look to this image. When I was writing my book with the two colleagues, we were performing every day a lot of materials, or better, what we consider at that moment that was interesting. And it was a new material that was going to be released at that time. Let's have a look to this bite. And first of all, I needed to use a lot of liquid dam over there, so a lot of time and a lot of money that I am losing over there. And second, these pre-charged trays are not the best. Why? Because if you have a malpositioning, a diastema, or something that is unconventional, not like for a normal uncustomized bite, you can have some correction to do later in a second moment, like here for the canines. And the result is not the best. Even though you correct in a second moment, it is not the best message of marketing that you give to your patient. Other case that I have performed with a new material for that moment. So same way to diagnostic process and protocol of photograph. And let's have a look here. There is a discolored tooth due to a previous endodontic treatment, and a discoloration, maybe a pigmentation and an old composite here. So I informed the patient before, and this material became, during the application, became hard and really extremely hard, like the resin, like acrylic resin, like a stone. And so it was impossible to cover all the surfaces, because before it became hard, and second, it was very difficult to be removed. So I recommend not to use strained materials. If you want to use a material, use it, improve your skills, read the instructions, and then use it, and don't try to change with strained things. Even though the result was not bad, but I think that if something is too difficult and too complicated to be managed, I prefer not to be to have my life complicated. So an important side effect that you can have, and it is in this section and not in the section of side effects, is the dehydration effect. It is a very common possibility that we can find, and the very important tip is to evaluate the starting point, like in this picture over there, because after the treatment it's always common that the patient requires a mirror just to check and to evaluate with the self-evaluation. And if you have don't inform, and if you didn't inform it from the beginning, you can see that these white stripes are more visible up to 72 hours maybe, like the dehydration effects, even though after 2 days everything fits perfect again. So inform the patients and evaluate the starting points for any situation, also for fluorosis or tetracycline stains, as in the lesson of discoloration, or in situation where we have white stripes, white areas. So estimate always the starting point and evaluate, because if this is your starting point, maybe these white stripes, due to many reasons, needs to be managed, and we need to inform the patient of two things about this case, in this particular case. The first one, that I will not for sure can guarantee the 100% result, because the truth is, with white stripes maybe it will be better, and maybe something will happen in terms of improvement of aesthetics, but I will not solve this discoloration at all for 100% of cases. And second point is that if you have this type of discoloration at the beginning, you will see more